Hey everybody, how are you doing? We're about to learn everything that you wanted to know about endometriosis, but probably were too afraid to ask if you're trying to support a person with endometriosis. And if you have endometriosis, we're going to touch on some things that are probably going to help you be a better advocate as well. So, I'm Dr. Virginia. I am a board certified psychiatrist as well as a lifestyle medicine specialist. So, double board certified in those two areas. So, why are we talking about endometriosis? Well, first of all, it is a global health phenomenon with incredibly high rates in several countries throughout the world, not necessarily including the United States. So we have to be thinking about this because this is one of those things that does impact quite a few people. We're talking about women literally all over the world who are struggling in this area. And some people don't even know what it is. So there's this thing called the Bite the Lemon Challenge, where basically, literally, they're asking you to just kind of bite into a lemon. And the reason for that is because it's acrid, it's startling, it's sour, it's uncomfortable. It's one of those things that you would not normally think about, right? When you're biting into a lemon, those are all the things that happen with a woman who's dealing with endometriosis. So, endometriosis is basically ectopic tissue. And it's the tissue that should be on the inside of the uterus, but it's outside the uterus, in and around the belly area. Okay. But usually it stays around the reproductive organs for a woman. But that biting that lemon, as I said, it's basically equivalent to what women with endometriosis experience not just once a month, but sometimes multiple times. The bitterness that's associated with biting a lemon, the unexpected, like you kind of know that a lemon's going to be sour, but when you bite into that lemon, especially if you're biting it from outside and you're including a little bit of the peel or you're biting a portion of that, you're getting something that you would not expect. You're getting the sourness, you're getting, even talking about it, my parotid glands are increasing the saliva production because it's trying to prepare me for it, but you can't really prepare for that very acrid, sour taste that's going to come from literally biting a lemon. But that is the awareness campaign for 2026 and beyond, just to remind people that, hey, this is part of, just a tiny little skosh, just to raise awareness, that this can be, again, a very bitter thing to be dealing with. Bitterness issue number one is that even though it's a global phenomenon that impacts women, it's a global phenomenon that impacts women. Okay, let's just be real. Let's just be honest. There aren't tons of research dollars that go into education, awareness, diagnosis, and treatment of women's health conditions the way it goes into men's health conditions. Okay, think I'm wrong? We came out with the pink pill Viagra for erectile dysfunction many, 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 many moons ago, right? Now I could say basically decades ago. We're still looking for the equivalent for women. Yes, some people might say it's a bit more complex for a woman. Yeah, it can be. But does that mean that we shouldn't have had something by now that could be potentially billed as the same version for women? The research dollars just don't go into conditions that impact women's health the same as ones that impact men's health. And that's just true. I don't care what country you're in, it doesn't matter who's in control, which party, it doesn't matter. This is just a fact, and this is just it's just a known fact. The other bitter thing that you have to swallow, of course, is that not only is this an issue that most people just automatically think, oh, endometriosis, you only have to deal with it once a month if you're dealing with menstruation. You only have to deal with this pain, right? This one time. Not true. Just like the material is outside of the uterus, the pain that a person might experience can be outside of the menstrual cycle. It can happen at any time. It may be more intense. There may be some predictability about when it happens for some women, but for other women, it could be at any time. It really does depend on what's going on with their hormonal status at that time and what they're taking exogenously or externally to help them out. Another bitter thing that has to do with endometriosis is the fact that it is a chronic illness. It's a chronic pain disorder. So we automatically think, usually for chronic pain, things like a person, had an amputation, they've got chronic phantom pain, or they've got some kind of, rheumatoid arthritis or some other kind of other medical condition that can cause chronic pain, chronic fatigue syndromes or fibromyalgia or things like that. And that's all we're thinking about. We're not thinking about the fact that endometriosis can go on the full length of time for a woman's reproductive history, and in some cases, a little bit beyond, depending on when they actually do enter menopause. So that means this woman can be literally suffering for decades upon decades with this chronic condition, and we don't really know very much about it. So for you, there's always a place for you, whether you're dealing with the condition or you're not, a place for advocacy, a place to share the hashtags, a place to share the concerns that you have, a place to support a person, particularly from a mental health perspective, right? By validating them, by acknowledging the stress that they likely may be under, by asking, hey, is there something that I can do that might be of help or might be of support? Even just an encouraging card, phone call, little note, text, anything. All of these things can be helpful in letting the other person know that you care. Another thing that can be helpful from an advocacy standpoint, obviously, is to talk to the local congressman, to talk to local politicians or folks in the healthcare industry that are in power to direct, I'm going to say direct, to direct research dollars towards early diagnosis and treatment. Why do I say those two things more than anything else? On average, it can take 4 to 5 years, not months, years to determine that this is endometriosis. Why is that? Well, a person can come presenting with symptoms, and initially it might be thought, oh, it's just related to the menstrual cycle. And then the person is put on, a cycle of pills or patches to help with the menstrual cycle, right? To kind of regulate it, possibly to reduce the amount of pain. NSAIDs, non-steroidal anti-inflammatory medications. That's another thing that a patient may be put on: ibuprofen, Motrin, aspirin, and then the headache hitters like diclofenac or indomethacin, Celebrex, those things. A person may be put on those, and so you're going kind of back and forth every month, right, or every 2 months or 3 months or so, trying to deal with what we think might just be, severe menstrual difficulties. And then beyond that, there might be the concern that, wait, there might be something else going on here. So then you start getting into the imaging, right? But what's the very best imaging, right? Is it ultrasound? Is it CT? Is it MRI? And when you start seeing certain conditions light up in these different imaging modalities, how do we 100% know that this is truly endometriosis and not some other ectopic tissue that's not endometriosis? Okay. So there's a concern there. And so the sine qua non is basically histological studies, to actually take a piece of tissue, put it under a microscope, let a pathologist look at it and say, hey, yeah, from a histological perspective, I'm looking under the microscope, very high powered microscope, and I can tell you, yes, this tissue that you got from outside of the uterus is uterine tissue. Boom. 100% this is endometriosis. But did you see all the steps that we went through to get there? It's not like you're going to get a diagnosis. It's not like you sprain your ankle, you go, you see an x-ray, you see the bone looks fine, but we can look and see, okay, it's probably some tendon or probably some other damage. Or if the person just went right to a CT or MR and you said, yeah, I can see that this is just a simple sprain, or I see you've torn a ligament or something like that. Those diagnoses tend to come a little bit faster, right? You hurt your ACL, your MCL, a little bit faster because we can do the imaging right away, do the physical exam, do the imaging right away. Not so much with something like endometriosis. It can take a lot more time. And because of that, that means that that's more time that that person is likely suffering with the condition. And so that's when it becomes that chronic pain condition. And what are a couple things that patients deal with during that time? Number one, the gaslighting from both the medical community, but also from laypersons. Oh, it's really not that bad. I went through that when I was your age. That may be true because there is a hereditary nature. So your mother or aunt or someone else might have gone through that. But the fact that we kind of play it down, oh, I dealt with that. That's the curse of Eve. Oh, you'll get over it. Mm, maybe not so much. So the gaslighting from family members, I dealt with it, so you can deal with it too. But why should they? Right? We all want our children, our progeny, our legacy to do better than we did. So why do we want them to suffer like we did, especially in this case, right? From the medical establishment, whether it's intentional or unintentional, there's gaslighting there as well. Oh yeah, this is probably just likely menstrual cramps. This is probably just likely very severe menstrual issues. So let's go ahead and get you on these NSAIDs or do these other things. And then if the patient is saying, hey, it's not getting any better, it's not getting any better, it's not getting better, why don't we go to imaging more sooner, right? More as an initial step as opposed to after months or years with patients suffering. The education process is something, unfortunately, there could be unintentional gaslighting there, where we're saying to a person, oh, it's just this, or oh, it's just that, when realistically, we don't 100% know what it is unless we've taken a small snippet, a little biopsy, right? And done that. This is also where things like insurance coverage comes in, because even if a patient is having significant symptoms, they may be delayed in the type of imaging they can have, including an ultrasound or another imaging modality to determine if there is any ectopic tissue, or the biopsy, right? That might be something that, no, we need them to have a trial of this, or we need to have, prior authorization for that. And then we're going to approve or deny that prior authorization and then make the provider go through the appeals process, which nobody wants to go through. It's never fun to have to do additional paperwork that, someone can come behind you and then dismiss again. Very frustrating for the provider, very frustrating for the patient. But these are all things that can delay further the diagnosis. And then even once there is a diagnosis, do we really have the best treatments that we could? There's definitely ablation, where a patient will, in a procedure, they will go, a surgeon will go in, and yes, there are GYN surgeons that will go in and ablate the tissue, remove the tissue, either cut out the tissue or burn the tissue, get rid of the tissue that's outside of the uterus. We would hope that that would make everything go away and everything would be great. Unfortunately, there are a percentage of patients that will have an ablative procedure, that will have a procedure that will get rid of as much of the endometrial tissue that they can reach or that they see, and then the patient is still in pain. So then you might have to go on to more extreme procedures, right? And so again, this is very difficult. This can be a chronic illness, and I want us to start thinking about the fact that it can be that way. It doesn't have to be, but it can be. And so if you or or a loved one are dealing with symptoms that could be endometriosis, very severe menstrual cycles or menstrual cycle like pain that's outside of the time of your typical menses, if you have already seen your provider and you're still struggling, this is your call to action to, number one, not give up. Don't give up, right? Don't give up until you're feeling better. Don't give up until you've got the proper diagnosis. Don't give up until you've got the support that you need, and don't give up until you have already received whatever it needs to be received so that you are having the minimal amount of pain possible. When you've done all of those things, as the song says, after you've done all that you can to stand, it's based on Ephesians 6. After you've done everything that you know to do, if you're still dealing with some symptoms, again, you might not have been able to ablate everything. You're still dealing with significant symptoms. This is the time, possibly, to deal with a chronic pain management program where they're teaching you through cognitive behavioral steps how to work with the pain, move with the pain, doing things that will help minimize the pain as much as possible. That should have already happened by this time, but once you get in this place of acceptance, and there, yeah, heck yeah, there's a grieving process. There's a grieving process that goes with all of this. But once you've gotten to the place of acceptance that, hey, we really have done everything that we can from a medical perspective, then again, that's when we might need to start thinking about, well, gosh, do I want to be thinking about an extreme surgical procedure like removal of the uterus and all of the reproductive material and then going into early menopause? Yeah, you have to think about that, especially if endometrial tissue is on the ovary. Infertility, dealing with the fact that there may be some signs of infertility or concerns for infertility. All of these things are things that can happen with endometriosis, and they're serious concerns. And they all have a mental health consequence connected to all of them. So, again, my sincere advice is that you do not give up. Well, can't give advice because I give advice, yeah. Um, my advice in a quarter may not even buy you a cup of coffee, but this is what I'm going to tell you as a voice of encouragement and reason. Because again, I'm a psychiatrist, but I may not be your individual psychiatrist. Don't stop until you get someone who hears you, who validates what you're experiencing, and who is there to support you. There are support groups, there are specialists, there really are all the things out there. We just want to make sure that we've raised this awareness alarm to make sure that you are getting the support that you need. Okay? I hope that you have a very blessed day on purpose and that you take care of you.